Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here with Dr. Sara Figueiredo. She's the director and research director of this institute. Doctor, how are you? How you been doing?
Oh, I'm wonderful. Thank you so much for asking, Louise, and it's a pleasure to be here as always.
Well, it's always nice to have you back. Doctor, there is well, people are wondering what stem cells are in general and how they can work for us to feel better in different illness or diseases. So why don't we talk today about these stem cells? What are these stem cells and how they can work to benefit our lives?
That's a very good question, Louise. I've had this question a lot, and because people hear about stem cells all over, everywhere. You hear about it on the news, you hear about it, a so-and-so person or friend got treatment, the stem cell treatment, and a lot of people don't really understand what stem cell treatment is, and there are a lot of misconceptions about stem cell treatment. So I'm glad that you asked me that. Basically, stem cells are cells that can regenerate themselves. They can regenerate themselves, they grow and regenerate tissues. Okay, so what happens is when there is a damaged tissue or a disease condition where there is some sort of anomaly, stem cells go in and fix or reconstruct the damage. Okay, so for instance, in diabetes, the pancreas is malfunctioning because the islets of Langerhans cells don't create enough insulin. And so what stem cells can do in that case, especially endometrial stem cells, what they can do is they can go in and regenerate the damaged cells and the damaged tissue in order to help and treat and in many cases cure diabetes. And then in the case of, say, an injury, a knee injury or a hip injury or a shoulder injury, what we do is we locally inject the stem cells in order to regenerate the damaged cartilage or the tendon or the ligament or whatever the case may be with that damage. And so that's literally what the stem cells do is they reconstruct the damaged tissue. Now, there's a science behind that. Now, how do they do that, right? It's a very general as to when I say regenerating the damage. So when we place the stem cells in the body, many times we do it IV and intravenously. And patients ask me, how do the stem cells know where to go? If the damage is in the brain, in the case of a stroke or a neurodiversity
Oh,
like
I
autism.
really want to
Or,
hear this. How do they? Because I was always wondering, how do they work? How do they know where to go? Yeah, sure.
right. Yes. And a lot of patients wonder this also. And so basically, two things happen. The stem cells go everywhere the blood flows. But how do they know where to regenerate damage? Basically, what happens is when there is a damaged tissue, um, this tissue secretes a cytokine, which is a chemical messenger that is specific for that tissue. And that it's the cell, when there's damage, a cell breaks open and it releases this cytokine, this chemical messenger that is only specific and programmed for that cell, for that tissue. So when that specific cytokine is released into the blood, the stem cells sense it, and as they're flowing through the body, and they get the message or the signal that, hey, there's damage in the brain in this area, or hey, there's damage in the spinal cord, or there's damage to the heart tissue or the liver or the kidney. Each cytokine is specific for that organ or tissue. And so that's how the stem cells know where to go. It's quite fascinating. Our bodies are amazingly our motto is to stimulate the body to heal itself, and it does. with stem cells. It's quite fascinating.
And what will be the treatment involved for a patient? I'm suppose all treatments are different, but what will be the normal treatment for any patient? Like that will cover any patient illness or
Well,
disease. What will be the normal?
I understand what you're asking, and that's another very good question. So basically, the treatment entails it's a very comprehensive treatment, because our motto is to leave no stones unturned, and that means that we will do everything that is going to help the patient, help the body, and help the stem cells to just work at their most optimum. So that entails a pre-treatment protocol that might include some key supplements. That'll include some key dietary additions or changes to the diet, which is we want to make sure that it's sustainable. It's nothing that is too intensive or too harsh that the patient can't sustain, so it's very sustainable. And those are some of the key things. So key supplements, antioxidants, a few dietary changes, and that's just pre-treatment. And then along with that, when the patient comes for treatment, we do a total detox, which involves a nutritional IV, which helps with detox. It's specially formulated to help the liver detox in the detoxification process with key antioxidants, as well as um, uh, suppositories, natural glutathione suppositories that are coupled with the IV, as well as B complex shots that just help the body in terms of detoxing and fortifying the body. And then we follow that up with oxygen treatments before and after. It might be in the form of exercise with oxygen or hyperbaric oxygen, depending on the patient and what they can tolerate, as well as age appropriate growth hormone therapy. So, if we have patients that are over a certain age, that we feel that growth hormone would help in terms of, again, sort of rejuvenating the body and helping the stem cells work better, basically. We will start that. And that goes for almost 3 months. We start that before and after. And also our proprietary stem cell enhancement formula, which is a blend of minerals, key minerals, and herbs that help the stem cells, again, keep the stem cells working at their most optimum and keeping the body functioning at its most optimum in terms to receive the stem cells. So that's basically the treatment in a nutshell, of course, along with the stem cell deployment themselves. And the stem cells can look like one, we do it usually depending on the type of condition we're treating. The stem cells can be deployed in one or a combination of three ways. That would include intravenous administration of the stem cells, and usually with mannitol, which allows the stem cells to penetrate the blood-brain barrier and allow the stem cells to get into the central nervous system, which includes the brain, the brain stem, and the spinal cord. And then we also deploy the stem cells intranasally through through the nostrils, and it's like a nose spray of stem cells. And thirdly, intrathecally, depending on what we're trying to treat. Again, intrathecally is into the cerebrospinal fluid along the spinal column, which is a very, very safe and effective way of getting the stem cells to the spinal cord and the brain. Again, if we're treating a neurodegenerative or a spinal cord injury or a stroke or autism, that's when we would use the intrathecal route.
Well, you mentioned stroke, autism, but I think it's important to mention that stem cells can work also for diabetes, emphysema. It can also work for erectile dysfunction, for hair loss, even
That's right.
for
And hair loss. Mhm.
kidney disease. I think you mentioned a few: macular
Mhm.
degeneration, multiple sclerosis, also for a different optic disease or optic injuries also, right, doctor?
That's right. That's right. The stem cells are so versatile that almost any damaged tissue in the body will respond to the stem cells. And there was only one thing that we can't do, and that would be to generate um, eggs in a woman, in a female,
Okay.
or to generate sperm in a male. So we couldn't, they're called gametes. We call these types of cells gametes. So stem cells, the only things that we cannot regenerate are the gametes in a male and a female, which are the reproductive cells. However, everything else can respond and will very well respond to stem cells.
That is great. I think one of the things that we should mention is that we have patients coming from all over the world, including patients that listen to this podcast have come to do some treatments. Is that correct, doctor?
That's correct. We have had a number of stem cell patients from literally around the world. And when we asked them how they heard about us, it's through the podcast. So we're happy to hear that we have some listeners that really respond to the podcast. So thank you for listening.
That's excellent. Doctor, is there anything else you would like to add to this program, to this episode?
No, I think, yeah, I think that we've covered a lot of ground today. And I think that perhaps sending out where people listeners can get information and
For sure.
where they can.
Well, if you want to contact us, you can do it by sending an email to info at the Stem Cell Healing Institute. That will go right through the doctor's phone, so she will answer your email. And also, you can contact us by dialing 502 4220 7297. That's our Guatemala phone number. And also in North America, that will be 209 690 7836.
And they can visit us on Facebook and Instagram also.
That is correct. Our webpage is stemcellhealinginstitute.com, and you may find more information on that page. So,
Yes.
doctor, it was nice having you once again here in the podcast, and we for sure will see you next week.
Thank you so much, Louise. I look forward to it. You have a good one.
You too. You take care.
You too. Bye bye.